So flea allergies is one,
Yes,
and then
kind of move on from that.
Yeah, the second allergy that we can talk about today is a food allergy.
Yes.
And I'd say that's probably is very common in young dogs specifically.
Yeah.
And we see it a lot in these dogs that are scooting
Yep.
and ear stuff typically. I mean, it can present any way.
Yep.
But that's the most common presentation that
Yep.
I feel like I see for him.
Yeah, I think so. My dog, I always joke you could put him on the PowerPoint because you could. For like a dog with food allergies, it's such a wide spectrum of presentations. It can be something so minimal as just recurrent ear infections, scooting, and those are typically things that owners are very like aware of. And then you'll have the dogs who also have recurrent, non-specific, intermittent GI problems. So they throw up a little bit more often than a normal dog would.
Sure.
They have soft stool, more often than a normal dog would. So you've got, some extension of the skin problems in ears and rectum. And then you've got some dogs will have GI stuff too. And then some dogs will have, just the same thing, the rash and the paws and the armpits. And that's why allergies get so, because we kind of circle back to, we're saying the same things over and over again, because it is the same things over and over again, right? So like, any of these allergies can have itchy paws, arms, and so that's why it can get a little bit difficult. But my dog, all of them. Like, he's got recurrent ear infections whenever he has a flare-up. He loses fur around his eyes. He has anal gland problems on my sofa. He gets the infections, and he licks his paws like crazy, infections in his belly. And we were up with him, like, constantly with diarrhea. Like, when we first got him, it was just like, oh, my gosh. He also had flea allergies. He has missing fur all over his butt. And we still have to give him Cytopoint every couple, 6 to 8 weeks. And so he's got it all. So I think food allergies can be, like you mentioned earlier, usually a young dog presentation. Doesn't have to be. And I think one of the biggest things that clients ask about is like, oh, well, they've been on the same food, their whole life. But in your experience, do you feel like that matters?
Not really.
No.
I mean, I think the most common allergen in food, or we know this to be true, is the protein in their food.
It's like 9 out of 10 times, maybe even more than that.
Yeah.
Not the grains.
Everybody thinks
It's not the grains.
It's not the grains. It's the protein.
Please, if you take anything from this, it's not the grains.
Yeah, exactly. So, even if your pet has been on the same food its whole life, I'm sure you're given treats.
Yep.
I'm sure it's had things outside of that food. And what if your dog does have a chicken allergy and has been on chicken its whole life?
And it developed it, because one of the things about allergies, and this is maybe not as well known of a fact, is like, there are, few allergies that you were literally just born with it. And the first time you see that or exposed to it, you're going to react. But the vast majority is exposure over time.
Yep.
And what that timeline looks like can be different for every dog.
Right.
So, yeah, like you said, you've been on chicken your whole life. Like,
well, did you develop a chicken
necessarily
allergy?
matter, yeah. But usually we'll get a food switch, like a history of food switch, a new treat, something of that nature.
Because people know that food can be a component to skin irritation.
Yes,
you know
I think
what
that's pretty well known.
I think that's something that's understood. So a lot of times we do get clients in that are like, I've switched the food so many times.
Yeah. Oh my gosh, I don't know what to do.
Exactly, and that can be kind of tough too, because it's like, well, then in that situation, that pet has probably been exposed to a lot of different proteins.
Yes, and how long, in your experience, do you feel like it takes? And this will tie into food trials and things like that, before like a dog, like their clinical signs will truly calm down when you switch a food. It can take
like 8 weeks.
It can take 8 weeks. That's 2 months. Like,
are
you switching food out that frequently? Like, how many different foods are on board at one given time?
Like, you're not gonna see a change
if you've been
like
switching
that.
foods every month or something. Like, you could have multiple different foods, so it can get. That's where it can kind of get
a little dicey.
Yeah, especially if there's like a history of a food switch. But no worries.
Yeah, so there's like
we got
options.
that.
Exactly. So, but the thing is I feel like it's tough, right? Because we wanna fix this underlying cause. We wanna get to the bottom of it, so we're not having to deal with all this secondary stuff. So if we want to know for sure, if this is a food allergy, I would say let's do something called a food trial. So essentially, what that's gonna be is you're gonna put your pet on one of two things. You're either gonna do a novel protein diet. When I say novel, new protein.
Kangaroo.
Protein that they have never had before. So kangaroo,
crocodile,
alligator. There's like
rabbit,
buffalo.
Then they have buffalo ones.
Rabbit, those kind of things. But the problem is most of these over-the-counter foods that you get, there are usually some cross-contamination with another protein that your pet may or may not be allergic to. So if you're really going to do a food trial and you're going to do it well, I would recommend a prescription diet for those.
And on that note, every bag, this is kind of what we experienced with my dog, and I hate to keep going back to him, but it's just, you learn the most when you go through it, right?
Yeah, exactly.
So we would put him on. So one of our favorite foods that we like to recommend, and I know I recommend it a lot, I'm sure you do too, the Purina Pro Plan Sensitive Skin and Stomach Salmon and Rice. It's great. Over the counter, it's great. We'd have one bag, he was doing so well. Like, no problems, no diarrhea, the itching was minimal. And then we'd get a new bag of dog food, and now we're up all night with him with diarrhea. And the reason for that is what you alluded to, is because they don't fully sterilize these packing plants between making a bag of chicken and rice and salmon and rice and beef and rice, right? So there's going to be kibble from other types of food in that bag, whether or not it's specified specifically on the label. And so one bag may be okay, and the next bag may be a nightmare. And it really, like, there's so much variability to it, which is why we recommend those prescription diets, because we're in full control, and the way that they are made, we know what's in the bag, we know how the proteins were made, we know what the proteins are, so there's no, that you take that variable out of it. Exactly.
Yeah, there's no way it could be contaminated.
Exactly. So that's why we recommend, we're not recommending these prescription diets because we're like, oh my God, like, you need a prescription. Like, but in this case you do, because there's way too many other things that could be in that bag of dog food.
Coming from someone who has done multiple food trials with their dog, and these foods are not cheap, okay?
No,
this
they're
is
not.
like coming from
But they're way cheaper than seeing us every 6 weeks.
Yeah, exactly.
Yeah.
Good point. Yes, but I'm just saying, if you're gonna do a food trial, just do it the right way. Trust me, not even from a veterinarian's perspective, from a dog owner's perspective of having to do it multiple times, because I thought I could do it different. And
Me too.
It would work out.
It would be better. It's okay if I give him a treat, or if my in-laws give him treats. It'll be okay, because it's not okay.
So
never works out.
Our soapbox about that. So there's the novel protein diets. We recommend those prescriptions. That's one option. The other option is something called a hydrolyzed protein diet. So this is essentially a diet. This is how I just explain it. I would say the proteins are broken into such small pieces, or into their individual amino acids. So there's really nothing for your pet to react to within those foods. However, not all of these diets are created equally. So do consult with your veterinarian prior to putting them on one of those, because, I mean, you'll have to anyway, you need a prescription for those. But I definitely have a strong preference for the diets I use for that, because they are not all created equal. So that's important to know and take away from that as well.
Like, they can scream hydrolyzed all over the bag, but,
the protein has to be broken into a small enough piece.
Better ones than we did.
Exactly. Some of the pieces, even though they're hydrolyzed, are still too big, and your dog can still react to them.
And another thing to note, and I wanted to say this earlier, and I kind of got sidetracked, when you're picking a bag over the counter, we talked about the contamination, we talked about stuff like that. What I've also noticed is that, they're like, salmon and rice is the protein, but then you look on the back on the instructions, and it's like salmon meal, chicken meal. So I encourage owners, if you feel like your dog may have a food allergy, like we mentioned earlier, it is probably going to be chicken. That is the most common. Doesn't have to be. But look on the back of the bag, because it might even tell you, like, oh yeah, there's chicken listed in the ingredients.
Oh yeah. I mean, I have sat down with so many owners, and we go on the back, the label of the dog food, and it's like
chicken meal,
chicken and everything. So it's like, make your life easier too by doing a prescription diet. You don't have to worry about that. Exactly. And it's just worth it. So basically, they're going to be on one of those diets for 8 weeks, because like we said, it takes about 8 weeks for the system to kind of, the skin to clear up, to kind of get those old proteins out, and kind of have a fresh start. And if at the end of 8 weeks you're like, I haven't been noticing that Fluffy's licking her paws as much, she's not shaking her head, she's not scooting her butt, you know what I mean? You're noticing that there's a big difference in how she's behaving as far as her itch goes. And then let's say at the end of the 8 weeks, you put her back on her old food.
And see what happens.
And if you had a response like that, the chances are high that you're probably going to start with some skin infections and itch and things like that.
And it can take a little while. It may not be right away. It can take a little while, but you'll start to see those signs kind of return, which is unfortunate. And big thing, food trial, nothing else in their mouth. Nothing else. Because as soon as something else goes in their mouth, you technically have to start all over again. And so that's another thing too, is like, they can be tricky, especially like for people who have kids who are like sitting in a high chair and like throwing chicken.
You know what I mean? Like,
my niece literally launched some chicken thighs across the house the other day, and I was like,
and your dog's not gonna be like,
oh, I can't have that. That's chicken. I'm allergic to that.
Exactly. So it is kind of like one of those things where not every household, I will say this, is a great household for a food trial.
Yeah.
Just to be honest.
It's hard.
But it is hard because it's like,
that's the only way to know.
We can't know if your dog, there's no
test.
blood test, and there's you're going to go on the internet and they're going to say, do this blood test.
Blood test.
But it's not accurate.
Because those blood panels will give you a list of like 200 things your dog is sensitive to, but there is a large difference between sensitive and allergic.
Correct.
There are a lot of foods I am sensitive to.
Right.
I don't like to have jalapenos.
Right, exactly.
I'm not allergic to jalapenos.
It's not going to kill you.
It's not the same thing.
Exactly. So it is. I agree with you completely. I mean, I think it's a hard thing because not every household is meant to do a food trial. Right. And that's okay.
Yeah.
But also be realistic in your understanding that we're not going to solve this problem.
Yeah. And big thing is that, I think we haven't mentioned this yet, but at least in the initial, we're going to have your dog on steroids to calm that allergy response down. Whether fleas, flu, environment, doesn't matter what type of allergy, they're going to respond to steroids. And so just because, you're maybe not doing the food trial all the way, they're getting scraps here and there, they can't live on steroids. So you just have to, like you said, be realistic in your expectations for fixing the problem if we can't fully execute a food.
And the reason we're kind of listing them in the order that I would rule them out. Does that make sense? So like, get on flea prevention, rule it out. Do a food trial, rule that out. Because a food allergy is going to be much easier to manage than an environmental allergy is going to be.
Yes.
Does that make sense?
Now, because I totally agree with that. And I feel like when I present it to clients, I'm like, okay, once we're on the road, right? Like we're driving down the road. And then we're going to get to a place where, we'll make a couple stops here and there with like, fixing fleas, fixing this, fixing that, secondary infection, stuff like that.
Yep.
But then when things recur, we're going to get to a T in the road. If we've got them on flea prevention, then we either go left or we go right.
Right.
If we go right, we're working up a food and we're doing a food trial and we're committing to it. And that would be my preference, would be to do a food next. But a lot of people are like, I can't do that. So now what happens if I go left?
Yeah.
And that's where we start talking about environmental allergies, because we do have medications that if your dog has an environmental allergy, they are Band-Aids, and we'll kind of touch on that in a little bit, but they're a little bit easier to assess a response quicker and easier to do because we're giving it, or it's just a pill that you give every day, than doing a food trial for 8 weeks. And I will say, when presented like that, most people are like, oh, well, let's try the environment first. And then if the environmental response is not there, then, okay, they're forcing me to do a food trial, and then I'll do my best to commit. And so then we just come back and we go right.
But I mean, okay, let's play devil's advocate, or let's just talk about like your road trip. I like that. Let's say that they do go right and they pursue the food trial, and that doesn't work.
We're going left.
We're going left. So we're going to talk about environment. So eventually we're going to go down that road if the food is not the culprit.
We're always going to end up, unless we get the magic answer at some point along the way, we do end up trying most of these medications before it's all said and done. And that's where a lot of pattern recognition comes into it. It's like, how'd they do on Apoquel? How'd they do on Cytopoint? How did they do when they were on that food? Because their response to those meds is equally as important as the main complaint you came in with that first day. Does that make sense?
It does make sense.
Yeah.
I think environmental allergies are really tricky.
Yeah.
Because, and I think a lot of people think, well, wouldn't my pet be itchy seasonally then? Wouldn't it be in the summer or springtime we're noticing a flare-up?
Yep.
One of the most common environmental allergies in these pets are dust mites.
Yep. Storage mites.
I don't care how clean your house is, you got dust mites. Storage mites, which can live in their food.
Yep.
So those things are very common. There's things in your house that could be year-round.
Yeah,
it doesn't matter what
there's
time
no
of year it is.
seasonality to that.
Exactly. And then, there are some dogs who are highly allergic to grasses, are highly allergic to pollens. What are you going to do? You can't not let them go outside and play and live their life. They need to live their life. You know what I mean? So how do we combat those things? So there's kind of two ways to approach it.
Not Benadryl.
Yeah, Benadryl's
unfortunately,
not gonna...
which is such a bummer.
It is. I wish it worked the way
Me
we
too.
thought it would.
Like 10%, I think, of dogs respond to Benadryl, and those small the very handful of patients I have that get relief from Benadryl, I'll tell their owners, I'm like, you were very lucky.
Yeah.
You were very lucky.
And honestly, I still even think with those, like, Benadryl is like a mild sedative.
Yeah. So then
they're
it's
sleepy
like,
and they're not scratching.
yeah. Are you just?
So it's not
That's
like,
so true. That's so true.
Like, your dog's not scratching, is it because they're sleepy or because they're not itchy? So it is one of those things.
That.
So I always tell people, it's like, sure, try it. If it works,
yes.
good for you. That is awesome. However, we also have to have, again, going back to those realistic expectations, that is probably...
That's what we should call this episode, realistic expectations.
Yeah, exactly. Like, knowing that, yes, it is the cheaper option. Yes, it is readily available. But is it going to work? Probably not.
Probably not.
So... yeah, I wouldn't go over the counter with these medications.
Zyrtec, Claritin, all that whole group of antihistamines, unfortunately, just don't do in dogs what we want them to do. But we do have medications. Yes, some that do. But we do have medications that work in the same way of, like, it doesn't matter what your dog is allergic to, these medications are going to work for that.
Exactly. Like, we have prescription, doggy, Zyrtec, if you will.
Yeah.
It's going to be, but
that's
I like
same but different.
Yeah. And I do call these Band-Aids. Because again, it is not fixing the underlying problem. If you want to get to the underlying cause of your dog's environmental allergy, I will refer you to a veterinary dermatologist. They can do some allergy testing.
This is just for environmental allergies.
This is just for environmental allergies, not for
food.
They can do some allergy testing. And you can get a list of all the things that they're allergic to, and you potentially do allergy shots.
Make a little vaccine. She makes the vaccine for you. Then you're giving shots at home.
Right. And the response to that, I think it's like, I couldn't tell you the exact numbers. It's pretty good.
It's like 80%, I think, response rate.
70, 80%, yeah.
I think. Don't get mad, Dr. Woodward. I don't know. But it takes a long time. Yeah. It's like a whole year before it's like, oh, wow, okay, like we've done it.
Yeah. And then you have some people who are like, I'm not doing that.
No, I want the Band-Aids.
I'm not doing
especially for dogs who are seasonal, because we do see, I'd say the vast majority are spring, summer. So starting in like March, extending to maybe into September. Now, this year has been exceptionally... God, the allergies are bad right now. Like, we're supposed to be getting a break right now, but they're
every day, multiple times a day. I see this.
My appointment before this, my appointment after this, and then one this afternoon. I saw you had one on your schedule this afternoon. Dr. Jim has one on his schedule this afternoon. Doc saw one this morning. It is, the
my
schedule is
personal
full.
dog, he's walking around, he's red.
Goose is getting side a point.
Yeah. So it's, we're seeing it a lot. But whenever someone comes to me and they're like, listen, I love Fluffy, but I'm not going to a veterinary dermatologist. I'm not interested in, and that's your prerogative. You do that. So then we need to start talking about what can we do to make sure that Fluffy is comfortable. So there are a few options. I'm going to talk about, I guess, our favorites for that are safe long-term use. So there's a product called Cytopoint. It's an injection. It's labeled to last 8 weeks.
My favorite.
It's very good for itch. I would say response rate is really good too. But there are going to be some dogs that don't respond to it.
Correct.
So just be aware of that. But that is something that you can use. Again, this is a Band-Aid. This is not fixing the underlying problem. This is probably something that your pet is going to need long term.
Yeah, probably every 2 months for the allergic season, which may be year round or it may be seasonal. It just depends on your pet.
The other option is Apoquel. This is the way I like to describe it to owners. This is the closest thing you're going to get to a steroid. Without it being a steroid. It's
not a
the
steroid.
Safest thing you can use. That's going to be the closest thing you get to a steroid. So it does not only itch, but it also does inflammation. So, especially in some of these dogs that are so red and so inflamed, Apoquel is a great option for them. But again, it's something you have to give every day.
Every single day.
And it is a Band-Aid. It is not going to fix the underlying problem. So these are great tools. I use them on my personal dog. I think they are awesome. But again, realistic expectations, bringing it back to that, knowing that we're going to use these things, but your dog, this is a lifelong problem.
Not fixing the allergy.
Right, this is going to be something that you have, this dog's never going to go away.
Right.
And that we're just kind of saying, this is to make Fluffy feel comfortable. This is to help with the itch and stuff like that. So that's
the way and to kind of touch on what those medications do, because they're not antihistamines, that mitigate the allergic response in that way. What they basically do is they're like antibodies, well, at least Cytopoint is for sure. But what they both do is that, there's something that sets off the cascade, whatever it is. If it's a tree, leaf, flower, pollen, mite, like it doesn't matter what it is. It's something sets off their itch cascade. And then if you look at it like biochemically, and you can get all fancy with it, but there's like a million steps that go on in the body to get to the point where they actually scratch, right? And so theoretically, if you can stop that itch cascade from proceeding, let's say at step 404, then they'll never get to the point where they're actually scratching, which means they don't get to the point where they break that protective barrier in the skin. The staph, the yeast, none of them get involved. And so you are stopping the allergic response, and you're hopefully, if doing it within an early enough time period, you're preventing all those secondary infections as well.
Right, exactly.
So you're breaking that cycle and preventing at the same time. But the biggest thing about that is being vigilant. If you're giving Apoquel, you can't miss a dose. And if you're doing Cytopoint, then I have some dogs who will start to wane at like 4, 5, 6 weeks. And so really paying attention at that 4-week mark or that 5-week mark or that 6, 7, 8-week mark on the first time you see him scratch. My parents' little dog, he has environmental allergies. And that dog will be laying in bed and he'll do like this on the back of his head. To the vet, getting a Cytopoint. And so he's never, I don't think he's ever had like secondary infections, anything that he's had to be on meds for. Because if you can get to it really, really quickly, these medications work really well for that, but they don't treat secondary infections.
Good.
So if you have like a client, and that's a big thing I feel like people can get frustrated, is like it doesn't take much for them to get those infections. So any lapse in medication time can set up for those infections. So we'll have people call like, Apoquel's not working anymore, Cytopoint's not working anymore. And that may be true because some dogs do ultimately develop, a resistance to it over time. It's more likely that there's something else now going on.
Yeah, like does your dog have an ear infection now? Or
exactly.
A skin infection?
So there's infections we need to treat.
Right, exactly. Or is there something, and this is my line of thinking, and I don't know if you agree with this. Apoquel, Cytopoint, some people are maybe still using Atopical, I don't know, but if you have a product that works really well, there's going to be some point where it's not.
Yeah.
And we're going to switch stuff up. But that's just kind of like the nature of this.
That's just
and that's what makes allergy so frustrating is because we have all these products and they're great, but they're not going to work forever, or they may work at this time of year, but not at this. You know what I mean? So it's very variable in like response. I mean, I think it's a tough thing. Yeah. It can be a frustrating long road.
Yeah. Realistic expectations. Yes. And just to kind of recap, if you come to us and your dog's itching, right? The first thing we're going to do is treat for fleas, and we're going to treat whatever else is going on. And that usually looks like, and if your dog's on flea prevention, then obviously we'll do other things. But it almost always looks like steroids, at least the first visit. Usually steroids, because steroids work. I mean, they have their side effects. There's no doubt. They drink a lot, they pee a lot, they're probably going to eat a lot, they may pants a little bit, but we try to mitigate that with the dose that we use. But steroids are going to be the first thing, and then we're also going to treat if there's a secondary infection there. So did the yeast go crazy, did the staph go crazy? Side note, not the same staph you and I get.
Different.
Can't be transmitted to people, nor can it be transmitted to other pets in the house. This is staph that exists on their skin. It's usually just hanging out, but if given the chance to go deeper, it will. And that's when you start to see the redness and the pustules and the papules and things like that. So we'll treat for that. That may look like a shampoo. That may a medicated shampoo. That may look like oral antibiotics, oral antifungals. We have mousse sometimes. It's really good for the paws specifically. It can look like anything, but if it's an ear infection, we'll treat for the ear infections. And then we'll kind of give you a choice, like where do you want to go with it? Do you want to try food? That's what I would recommend. If you don't want to try food, let's try either Cytopoint or Apoquel. So that's kind of what an allergy appointment tends to look like. And then the response to that and the timeline on when it recurs tells us a lot about, how we need to tweak that. So we just ask for patience with that.
Because it's a long road, you know what I mean? It's like, okay, your dog doesn't have flea allergies. Great. Let's see if it's food allergies.
Right.
Doesn't have food allergies.
Great.
Let's see if it's environmental. So it's just a stepwise process, and it's the right way to do things.
And I would say on that note, most there's differences across the board, but for the most part, we all pretty much handle these cases the same. And so that's a good thing too. Like if you're seeing someone, chronically for allergy stuff, and let's say you can't get in with them, like don't fret. We typically all kind of do the same thing, but let's just say we can't figure it out. There are veterinary dermatologists. We are lucky enough that one does come here every couple months, or will come if needed. And so there is light. All that's to say there is light. We will figure this out. You do not have to stay up all night because your dog is licking their paws or scratching, because something about that is so loud at night. I don't know. You're like falling asleep and it's like so loud when they get after it. It's so frustrating.
It's an intense sound.
Super frustrating.
I've grown used to. I guess,
on that note, with the paws though, do you feel like some dogs kind of will do it like habitually, or like a nervous type of tick?
Yes, I do think that. I think that how it's hard though, because it's like, I don't want to, like, you come in, your dog's licking its paw.
Yeah.
And I say, oh, it's just habit. It's anxious. It's boredom. It's whatever. But what if your dog's really itchy?
Yeah, like what if it's like genuine?
Yeah, so it's like you still kind of need to either treat for infection or try and figure out why this is happening.
Yeah, because even if it's habitual, they still get that moistness, and even if it's habitual, they're still going to set up for secondary infection. So it's kind of like
almost like you want to rule out an allergy or rule out itch first before you say, okay, this is just boredom, because it's not really fair.
No.
You know what I mean? So I think that it's like, if you're itchy, that should be addressed, you know, but...
Miliary dermatitis in cats. So they get crusting and scaling and stuff around their chin and kind of over their eyes and their paw pads and things like that. So it's a little different for cats.
Get all kind of... Cat skin, cat allergies is the worst.
That's a whole different conversation.
Oh, gosh. God. It's just like such a hard thing to navigate because they don't have Apoquel and Cytopoint for cats. So then a lot of times people want to use steroids, but steroids aren't great for long-term use. So it's
and we end up then try medicating your cat every day.
And cats can
get
like
luck.
These
I'll pray for you.
Plaques on their lips and their bellies, and that can be as frustrating as dog allergies are. I would say cat allergies are even more frustrating. I have a few clients who are just 100%. Amazing, and they have done everything right.
Yes, everything right.
And we still
can't figure it out. Yeah.
Run into an issue with this. Yeah. And so it's just so
And then it's one of those things where it's like, oh, I'm telling you, there's a medication you can give your cat every single day that might help. Now you have to medicate your cat every day. Oh, a food will fix it. Cats are picky. So it's like,
Yeah, I like
realistic expectations, please.
Like shout out Taylor's owners.
Shout out Taylor Romero.
Taylor, if you're watching this.
Taylor, yes. We love you. We miss you. That doesn't mean you need to get sick and come in.
Yes,
but
exactly.
Anyways,
but they've
done everything.
Oh my God.
And obviously there are others, but that one is. We've all had a hand in that.
We've biopsied and done everything. I mean, they're amazing.
Yeah, they are. Anywho.
But it's just a testament to say, and even he still, with all those things that we've done for him, he has flare-ups.
Yep. And reactions to the meds sometimes too, which is also
and that's just kind of the nature of that beast, though.
Yeah. On that note, just because I feel like some people ask me about this fairly often, do you feel like there are side effects with Cytopoint and Apoquel long term?
Good question. I think Cytopoint, I like to think, is relatively safe. I think it's the adverse effects are similar to any injection that you might give.
Yes, so pain on injection site.
Pain on injection site.
It does burn when you give it, so that's something I always, every single dog that I warn the owners, it's going to burn. They don't cry. They don't even flinch.
Happens to me too.
But if I don't say anything,
they're going to scream.
Screaming.
Yeah, I know. It's really sad.
So it might burn. They get over it very quickly.
I don't know if they wrote that down anywhere that that's the case, but experience tells us.
100%. My parents' little white dog, first time he got it, he screamed for ever. And I was like, from now on, I'm always going to tell people.
Yeah, exactly. I feel that way too. But so a vaccine reaction could occur with that.
Yeah, always.
Outside of that, pretty safe.
Yeah, I haven't had any issues. Pain on injection site, that was it.
Apoquel, I guess both of them are like immunomodulatory. So it's not an immunosuppressant, but it kind of modulates their immune system. So we may want to keep a close eye on some white blood cells and things like that.
White blood cells for sure. And then there was some correlation with and again, most older dogs get lumps and bumps, right? So most of them are not on Apoquel. So then there was a subset of dogs who were on Apoquel, and so they tried to make a correlation with it. I think,
Yeah, the last time I went
it's hard to say. Causation, correlation, it's hard.
Last time I went to kind of like a continuing education about that. I think you were there too.
I don't know.
I felt a lot better about it. I felt like it was much safer. Yeah. And I would much rather have my dog on that than on a steroid long term.
1,000,000%. There's no question.
That's just my opinion.
There's no question.
So, it's a lot. It's a lot to kind of talk about, but I think it's worth talking about. And I think
definitely.
That
and it's a lot of information to take in as an owner. We talk for 20, 30 minutes about allergies, and you're just like, wait, so now what are we doing? So a lot of us have like little like handouts and stuff that we can send home too. And if you obviously have any questions, like, please at least take from this that it's not super easy to just answer one-off questions here and there. It is, a workup, a process, and seeing things. But we are obviously always here.
Right. And I think every allergy appointment is going to have some variation of this conversation.
100%.
And, happy to have that conversation.
Yep.
I think sometimes we almost have to have that conversation multiple times
because it's so much information.
And it's so much information, and that's okay.
Yep.
And also know if your dog has allergies, you're not alone.
No.
And that if you're frustrated, that's okay.
Yep.
And
I feel your pain.
Yeah, it's one of those things where we'll get through this together.
Yeah. As long as you're like good to, we're team Fluffy.
That's right.
And we're all on the same team.
Exactly.
And if we don't figure out the first time, we're still on Fluffy's team. So we'll get there eventually.
Yes, absolutely.
But yeah. So now that we just talked about allergies, I'll probably go see my next allergy appointment. And we talk about this again. Ready to go. Yeah. Maybe we can just like have the podcast playing in the room.
Yeah, just like let them
just
watch
casually for allergy appointments, just like like waiting room music, if you will.
Just
see if like anything pings your brain. But no, I'm just kidding.
It. Yeah, no. No, I think it's good. Yeah.
Yep.
Well, that's pretty much it.
Okay, so thanks for watching. If you enjoyed that, we do have other episodes out there. We talked about fleas and ticks, which talks about allergies too, and then we talked about heartworm disease as well. So we hope that these are informative, and we hope that you're enjoying them, and we're going to just keep doing them on really important topics. I know we want to talk about acupuncture. I know we want to talk about cats with urinary problems is a really common thing that we see. So we've got a little running list. If there's anything specific, let us know.
Yeah. Yay, exciting.